In the year 2030, Pennsylvania's population of residents 85 and older is expected to nearly double. Long-term care advocates say the Commonwealth is not prepared.
And today, Erie News Now state capitol correspondent Brendan Scanlon heard from advocates who are calling for additional funding in the upcoming fiscal year.
Behind me are the women and men who have cared for our most vulnerable population.
Despite a historic investment in Medicaid in last year's budget, health care advocates are worried about the future of long-term care.
Our demographics are barreling down the tracks, and we are in no way ready in Pennsylvania for what's coming.
More than 70% of nursing home care is paid for by Medicaid. PHCA President Zach Schamberg says last year's investment was about survival. This year, it's about sustainability.
We need to ensure that our senior citizens and our adults with disabilities can access the care that they need and deserve.
With a new fiscal year just around the corner, Schamberg and advocates have a simple question for lawmakers.
Who will care for our aging population if our providers cannot afford to keep their doors open?
We definitely need another increase this year for sustainability.
Providers like Noelle Kovaleski hope the legislature will care by making a $99 million investment in this year's budget.
Without that, I'm afraid the future is pretty grim for long-term care.
$42 million would fund infrastructure and operational expenses.
The cost of food, labor, and utilities continue to climb at monumental rates over the past 3 years, and we did not have the revenue stream to support it.
And $57 million would fund workforce recruitment.
The biggest challenge, period, is staffing. We struggle, every nursing home struggles to keep their staff, to retain their staff, to hire new staff.
Advocates say it's time for a long-term solution to long-term care. At the state capitol in Harrisburg, Brendan Scanlon reporting.